Okay, all right. So the rationale is that in the Pacific Islands there's a very high prevalence of obesity, that is between 15 and 35% of the adolescent population, which means that the health and wellness of close to 2 million people is threatened. What is worrying is that it's projected to increase in the coming years, and the projections are obesity in adolescents is going to rise by 4.5% yearly in the next 15 years. So this situation is a bit worrying because most of the countries in the Pacific wouldn't have the capacity to care for adults with potentially non-communicable disease that are resulting from the situation. So this is something that we need to take seriously, particularly in the adolescent population, because this is now a very large part of the population, the highest in human history globally, but in the Pacific region as well, and quite understudied overall. So in terms of the prevalence of the risk factors for development of obesity and overweight in the Pacific, studies show that 86% of adolescents are insufficiently active according to the physical activity guidelines, which says that adolescents have to engage in 60 minutes of moderate to vigorous activity daily, and 76% of adolescents combine low physical activity and poor quality diets. We run systematic review to try to understand what kind of intervention could be potentially effective in terms of addressing physical activity and diet. And with the physical activity, what we found out was that physical activity and sports programs that are committed to communities through formal co-design partnership when needed. So there's a lot of interventions that have failed to achieve their expected outcomes in terms of engaging people in more physical activity, shifting the diets, and potentially influencing the rise of overweight and obesity. And one of the reasons may be because most of those interventions haven't been designed with the population as partners. Additionally, the regional framework on nurturing resilient and healthy future generations in the Western Pacific, which is a report from the World Health Organization, recognizes a central role for schools in nurturing health and well-being in students and community as a whole. So here you can see two things that I'm going to develop through this presentation, one being partnership for co-design and the other one being centered around trying to develop partnership with schools. How are we going to do that? So we set to use the conceptual framework for measuring adolescents' participation. This is a framework that's been set up by UNICEF, and the principle, the rationale of this engagement is that first, adolescence is a unique window of opportunity for well-being, health, and development, with the condition that it is through genuine partnerships. Collaboration in co-design is also a way of advocacy and enablement, empowering young people to advocate for their own health and well-being. So engaging with young people, determining lived experiences, views, attitudes, and priorities must be a focus of research and education strategies. And with citizen participation, existing literature shows that it enhances the relevance of research outcomes, amplifies impacts in communities, and addresses real-world challenge. So we used this part of the framework, figure 2 on the right side, with participation leading to different forms of empowerment. And the one, so there's empowering within, with, and to. And what we have kind of identified, self-confidence, enhanced knowledge within, empowered within, and then building partnership and collaboration, slowly, shared understanding, and influencing decisions affecting them to inform policies and legislations are the focus of this work. So our working hypothesis is that adolescents are capable of meaningful participation that can inform research priorities and designing intervention. and participation is a way of empowerment, enhancing the relevance of research outcomes. So our aims in that study was through collaboration with adolescents to identify their priorities to achieve healthy lives and well-being, to explore how digital technologies could be leveraged to address challenges and enable positive change, and to co-produce research outputs. In terms of the methods, we identified 3 very important phases. In the phase 1, this is a phase within which we designed a workshop with set activities designed by us, the researchers, to try to get a sense of the students' views and attitudes towards physical activity and food. And Juliana is going to present our results on the food aspect. And phase 2, which is what I'm going to present in the later slide, is the second part, so extracting from what the adolescents have shared with us. In part 1, we have identified priorities and we have identified ideas on which they can work to potentially point to initiatives that may be useful for them. And part 3 is something that's still in the future, because that would be really to then help the students to become leaders themselves of their own action. So in phase 2, this is something we did last week, actually, and this week, so on Thursday and Monday this week in the school in Lumea. We used 2 questions, 7 and 9, doesn't really matter for this presentation, but really what they were is that in that question 7, we asked students to identify their priorities, and in question 9, we asked them to identify how digital technology could support the priorities. And we used that information to design the second phase of this project. What students had already identified, so we used those questions and conducted a theme analysis, a qualitative analysis to identify the themes, and a qualitative analysis as well into what they pointed to in terms of actions, which were some of them developing a campaign, developing a roadmap for digital tech, writing letters to leaders, or potentially participating in research. So this is the workflow we used to implement phase 2. So from the thematic analysis, based on the results obtained in phase 1, we identified priorities. So for example, on the picture, one of the priorities here is adolescents need more sleep. The second boxes are the what-ifs cards. So we used their ideas, what they had proposed to say, oh, if you need more sleep or if you need to engage in more physical activity, what if these things were in place? So that was a trigger for them to think about it. So we had the students, we used some methodology from design thinking and co-design. We had a canvas, and we asked the kids to work as a group and to start working on these ideas and providing more details about how, if you wanted to implement this idea, how is it going to happen? What do you need to kind of think of? And then that was the end of day 1. We worked with them for 1 hour, and at the end, we asked them to present their idea to the room, and the students listening had to provide feedback. So they had to provide feedback saying, what you presented, I like this and that, but I wonder if you could maybe think about this and that. So that was kind of trying to get them into that conversation. And then we came back on day 2, and this is where, in between, we had the time to read what they had proposed, and we, as well as researchers, provided feedback to them. And this is the loop we really wanted to get in, which was not the students or the adolescents in the room being participants, but being collaborators. So this is where we started the work to really engaging with them with their ideas, providing feedback, and the students responding to that feedback. So what we wanted to assess through this pilot was not necessarily how they developed the ideas, but that was to try to understand if that process of engaging, using their own ideas and priorities to start developing initiatives and potentially to get into, if we wanted to do that, what are the steps and how can we do research around that, because that would be our focus. We asked them some questions related to self-worth, self-esteem, efficacy, and as well experience of being listened and taken seriously. So the way the survey was designed, it was please answer each item by circling the number that you feel represents your gain. So the gain in participating in this workshop. So that was either for each question, no gain, coded 0, slight gain, coded 1, moderate gain, coded 2, and a lot of gain, coded 3. So we had 18 students participating in the workshop, and the overall average rate, I mean, it's very preliminary data because we finalized the study. I mean, we delivered the second workshop, second part of the workshop on Monday, but they rated 2.2 over 5. So, which means that they estimated, they felt that even if this was only a 2 hours workshop, working on their ideas and their priorities had some benefit. In terms of the experience of being listened to and taken seriously, well, the rating is even higher. And I made a mistake here because it's not over 5. I'm sorry. This is out of 3. Which means that with 2.7, we are very close to a kind of a very good rating. We think they answered the survey honestly because they didn't tick like all of the 2s or all of the 3s in the survey. They have really different questions, so there's a list of sub-questions to get to that average mark. It's not a mark, average, indicator. And they rated differently, so which means that for each question they really kind of thought about it. So again, that was, the situation was not optimal. We did phase 1 in November 2023. We did phase 2 in March 2025. There was a lot of time between those two workshops, those 2 phases. The kids were older, their priorities may have shifted, but still they were very interested and engaged. I have to say, the first day it was a bit hard to get them into the workshop, but the second day they didn't want to leave the room. So I think something happened. And 8 out of 12 adolescents are keen to continue working on their ideas with us as researchers and potentially develop the communication to the principal or to the school or to the canteen, depending on the topics they used to work on, and potentially to develop further research intervention. Thank you.
Thank you very much. We have about 10 minutes for questions. Yes?
How did you select the ethno-socioeconomic origin of your children, adolescents? Because we know that ethnicity is important.
Yeah, absolutely. So we haven't in this pilot study. So this project is, we built the methodology over the past 3 years, and we worked with different schools in urban or remote area. So what I showed today in terms of the results are kids who participated, adolescents who participated from a school in Nouméa, but we had in phase 1. But in phase 1, we engaged with adolescents in different schools with a different socio-economic diversity in Nouméa.
Ethno-socioeconomic.
Yeah. In ethno-socioeconomic, absolutely different in Nouméa. So in Nouméa, it's different attendance to the school, and one in Lifou.
Just the adolescents are key, and this is really key from this work, very interesting. Just I was wondering if you will look at what is their background, what did they get also as a base for their health during the childhood? Because we know that the obesity increased from the childhood, and
so in this work we have like the research background comes from the increase in obesity prevalence, but in everything we do engaging with the adolescents, we don't talk about obesity, we talk about the risk factors that have been identified for obesity. And that part of the study is about engagement, and we haven't yet really explored what happened before. It's having the adolescents together and as a group to think about their environment and think about their views and attitudes and what's happening and to share their thoughts. So this was phase 1, and we had very interesting data, qualitative data, and covering a wide range of aspects they had identified. But we haven't done a specific analysis of who are the kids that are in the room.
Maybe to complete, we work in schools in Nouvelle-Calédonie. This is fixed for this school. We work in schools since 10 years now, and we have a track record of the lifestyle and health variables regarding diet, sleep, physical activity, these accelerators in these schools. So it's quite difficult to have a longitudinal or longitudinal study, but once per year or once per 2 years, we get back in this school to have a global view of their lifestyle variable regarding the first year of the high school to the last year of the high school, between 11 and 15. So with this work, in parallel, we have objective variables regarding lifestyle and health parameters.
Yeah, this part is not to identify to do a survey of the health. This part is okay. If you wanted to increase physical activity in your school environment, family, what is it you think needs to be changed, and what kind of potential solution do you identify? And then we take them to them and we say, okay, this is the priorities. And they know what needs to change. Like, we need to get more sleep. We need to find ways to engage in more physical activity. We need to drink less soft drinks. We need to have a better skills to choose food. Like they identify that. They also identify things in the environment that should change for them to shift to potentially healthier diets. So this second phase was, okay, you have identified all of that. How would you do it? And then from that, we could develop interventions that are co-designed and informed by their experiences. Instead of being in the lab, reading research paper, which is very important, but most, if not all, of the interventions conducted in the Pacific region have failed to change anything, because most of them have been designed without the people in the room. So basically, this is we have the capacity, we have the tools, we have the expertise and the research background to design and implement research and interventions, but we need to understand if it fits the people who are living in the area, if this is something they are keen to engage. And as well, this is starting the engagement before someone arrives and say, too much obesity, you have to do that. It's really trying to engage people. And it's been shown that citizen participation is actually a powerful way to engage action.
In your study, and the semi-longitudinal part particularly, do you find the suggestion of solution? What is physical activity for them? It is running, it is playing basketball, it is playing tennis, what it is?
So, in the Pacific, particularly maybe in Nouvelle-Calédonie, all the guidelines talk about physical activity, but the adolescents, they talk about sport. So I think straight away we can identify that in the language there may be something that doesn't match for them, that doesn't work for them in what they say. And they say things very interesting around the cost of participating in activities. They say very interesting in terms of the equipment, buying shoes, etc., is very expensive. In the innovation, because we had a question about innovation, they talk about shoes that have different functions, which is a way to reduce potentially, to make the shoes more affordable. They talk about comfort. They talk about the capacity to have outdoors equipment for them, because the one that are out there at the moment is for adults. Like everything in this world, from the digital apps to assess physical activity, to the gymnasium, to everything is designed for adults. It's not designed for adolescents. So this is the and they identify that very differently.
And my last question is about do you try to investigate the accessibility of the different devices?
Absolutely, yes. So
because, for example, I'm paying for my little daughter for going to gym. It is 58,000 Pacific francs per year. So the accessibility is
so absolutely. So they say accessing gyms should be free. Like we shouldn't pay for gyms. Okay. So we say, okay, this is your idea. If you wanted to do that, how is it going to happen? Because not everything can be for free. So what are the mechanisms? And this is what we're trying to work with them to identify the mechanisms. Is it a partnership with the school where, I don't know, in the timetable, for example, there's sports time slot identified for the adolescents to attend for free equipment? I don't know yet. We have to work that together. Yes.
And just to add to that, I think a lot of what they're saying is that they want to be mandatory. It needs to be part of the curriculum that's
Yeah.
And there isn't a lot of that motivation to do it outside unless they have to. They say that it's mandatory.
Yeah, this idea that when they, it's interesting, it's like the phones, let's break the phone. If we use too much the phone, let's just break it. So we're like, oh, maybe there's other options. And then it doesn't mean we say, okay, you said that, this is what we're going to do. What we do is we try to provide evidence, so from research articles, which is difficult because everything is in English, French-speaking country. And then to start the process of reflecting. So there's a huge, it's difficult for them to go from, it's too expensive, let's write a letter, and we ask for this to be free. Well, how is it possible? In terms of the food, they talk about taxes, let's tax sweet drinks and let's have water for free. So then it's taking them on the road of developing their critical thinking and trying to identify solutions that could work because they are designed from research evidence and their perspective.
And have you involved, or do you plan to involve the teachers and the parents in the discussion at some stage?
Yeah, absolutely. So actually, I think Rowena is going to have a discussion with some of the teachers. We haven't yet engaged with the parents, but with the school and the teachers. So for example, all this work has been done through many visits. So the first time we come over, we visit and we talk to people when we have a survey. So we talk with the chef in the canteen, we try to identify where the food comes from, what the meals, how are they designed, etc. We try to understand how much physical activity or sport equipment is available in the school or outside the school. So we have information around that, but we haven't yet engaged with parents. We've done all of that through the 3 years of the Falah project. So I think the point where we are now is, I think we have the methodology, we are confident that the methodology works, that with all of the frameworks we're using and the workflow we are using, we are confident that the adolescents honestly engage with us. I mean, anyway, if they don't want to engage, they don't, I mean, we say, okay, that's completely fine, you don't need to engage. And those ones were young, they were 13 years old. 13 years old, they already identified lots of things. They know a lot of things. And they have very interesting ideas.